We're only 2 weeks away from the July 4th recess, and my friends on the other side say we're going to vote on a health care bill before the break. Democrats have still not seen the bill. The Republican Health and Human Services Secretary hasn't seen the bill. The American people have not seen the bill, and I'm sure many Republican senators haven't seen the bill either. The White House spokesman couldn't even say if the president has seen the bill. Now, this is a bill that it would likely reorder 1/6 of the American economy and have life and death consequences for millions of Americans. And it's being discussed in secret, with no committee hearings, no debate, no amendments, no input from the minority. This is the most glaring departure from normal legislative procedure that I have ever seen.
I've just got to say, this is the least transparent process for a major piece of legislation I have seen in my 24 years in the Senate. Former Senate historian Don Ritchie said that you have to look back before World War I to find another example of such a secret partisan process for passing a major bill. The Senate health care bill, in fact, is being written behind closed doors. There's no draft for public review. No Democratic senator has seen the bill. Republican senators all say they haven't seen the bill either. When Republican senators are asked what's in the bill, unless they're the 13 privileged ones, they say they have no idea.
We took an oath to represent all the people. So I am asking every member of this chamber to think long and hard about the consequences of this bill. Think about the responsibility we've been entrusted with. We owe it to the American people to tell the truth, not to hide it. We owe it to the American people to solve real problems, not to manufacture new ones. We owe it to the American people to do the job we were sent here to do. I urge my colleagues, vote down this bill and stand up for the people we represent and serve.
Now, the truth is, Mr. President, I can understand why Republicans do not want open discussion and open debate on this issue. Because the bill that they are working on, which is based on the disastrous bill passed in the House last month, is a bill that would do incalculable harm to people all over our country and really should not be considered as a health care bill. How do you talk about a so-called health care bill when you're throwing 23 million people off of health insurance? When we talk about a health care bill, the assumption is we are improving health care in America, not doing what the Republican House bill did, was to throw 23 million Americans off of health insurance. Surely that is not improving health care for American people. Cutting Medicaid by over $800 billion. And God only knows what the implication of that will be for the children, for the elderly, for people who are in nursing homes. You're not improving health care when you defund Planned Parenthood. And after all the rhetoric here about choice, 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 we want the American people to be able to go to their provider of choice. Oh, 2.5 million women who today get their health care through Planned Parenthood, I guess their choice doesn't matter.
For the Republicans, the most important thing about this health care bill is tax cuts for the rich. So they decided to cut Medicaid by $834 billion in the same bill so they can pay for their tax cuts. You know, this is straight up trade. The Senate Republicans say that Americans should cut health insurance for little babies or for seniors in nursing homes or for people getting treatment for opioid addiction, all so that millionaires and billionaires can get their tax cuts. That's not a health care bill. It's a statement of values, and it says that tax cuts for a handful of millionaires and billionaires are more important than health care for millions of hardworking Americans and their families. There's only one word for what the Senate Republicans are doing with this bill: shameful. It is shameful.
Americans do not want Trump care. 3 in 4 Americans want President Trump and his administration to do what he can to make the ACA work rather than undermining it. Even President Trump reportedly now considers the House bill, quote, mean. Went from great to mean. In the Rose Garden, it was great. Now, just a few weeks later, that same great bill is mean. Instead of listening to the American people, Republicans are pursuing a strategy that former acting administrator of CMS, Andy Slavitt, has described as sabotage, secrecy, and speed.
There was a process. And somehow, in the last 3.5 years, in the name of what? A vicious brand of partisanship that somehow undercuts not just the voice of Democrats, not just the voice of policy experts, not just the voice of hospital experts, not just the voice of medical professionals, doesn't just undercut their involvement in the process, but it is an insult to the history and the traditions of this body. This was not the constitutional intent, that something as important as health care should be done in a back room where a small handful of senators are trying to hammer out amongst themselves a piece of legislation that's going to affect tens of millions of Americans and change our economy and change our communities. There is honor in this place that isn't on TV. There are good folks on both sides of the aisle. I've gotten to know them. I consider folks my friends. I know their hearts. This does not sit well, the way this is being handled. I know it. And this is one of those moments of history that somebody just needs to raise their hand and say, you know what? I may even like that bill that came out of that back room. I may like that bill that was hammered out by 12 Republicans. But this process is wrong. It is an insult to our history.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.